What's going on, tribe? Coach Jake here. In today's video, we got a quick few minutes on some soft tissue mobilization around lower leg. This is a great video for anybody dealing with foot ankle pain, lower leg pain. Maybe you have a plantar fasciitis diagnosis, peroneal tendonitis, stuff along those lines. We're going to be covering the main muscle groups that live around lower leg and that act on foot and ankle for us. To get started, I want to grab a bigger tool. I got a standard foam roller here. It doesn't have to be this. It can be bigger therapy ball, barbell, kettlebell handle, whatever really floats your boat in that regard. And we're going to start with just some nice, bigger kind of global pressure up and down leg here. So we're going to start right above bony protrusions of ankle. We can keep rotating leg. We can pull toes up towards nose. We can step on the gas. And we're slowly going to inch our way up here. The big thing we're trying to accomplish with this time with our bigger tools here is some warming, some prep work for some more focused time and attention through these muscle groups. So just keep cruising up here. Take note of any spots that are feeling especially tender, sensitive, sore. That felt sensation is often a really, really solid indicator of some tissue that wants some extra time and attention from you. So once we get all the way up to knee here, figure out what's cooking that day for you, we can get into some more specific work. That's going to look like a smaller tool here. I got some tune-up ball pluses from Tune-Up Fitness. They're some of the goats in the industry. They make some of the best tools out here in the game. So we're gonna keep these balls stacked right on top of each other like this. One's gonna go on this meaty line on the outside of the shin here. So we have tib anterior, and then our peroneal fibularis group just below that, working down here, just above ankle. These are big stabilizers and movers of foot and ankle that'll often get involved with pain and discomfort in foot as well. So I like to start right here below knee, finding that good meaty stuff there. And then if you want to be really efficient, we can bring second tool right on top here. And what we're going to do is find our big prominent landmark for this, which is the inside ridge of tibia here. So you can start down here at ankle. You can draw a straight line and you should be able to trace that bony ridge all the way up to knee here. So to get in to tib anterior sibling, tib posterior, which lives on the backside surface of tibia here, we're going to start right on top of that bony ridge. Going to get ball placed right in palm of hand and heel of hand here. And then we're going to lean back a little bit to draw gastroc and soleus away because we're trying to access some of these deeper layers here with this technique. And then you can sink it back in down towards ground with a little bit of forward bias. We're trying to really get in to that back side, that posterior surface of tibia with this. So set a pressure level that's feeling good. Once you're there, we can rock and oscillate a little bit. Can also work with a little bit of active movement through foot and ankle. So you can make some circles, do some circumduction. We can pull toes up towards nose. We can invert, so we're going to lift toes and big toe up towards you. Really try to peel that bottom side of the foot off the ground. Once that spot's feeling a little bit better, we can shift down a little bit. So we're just going to keep inching along these lines here and keeping balls stacked directly on top of each other. Again, lean back Then push down and forward. Start working with some of that active movement. This is going to be a really good opportunity to get some of this soft tissue feeling better. We're going to see if we can get that improving and that sensation feeling better before we move along. Remember, those spots that are feeling especially tender and sore, that are creating some sensation moving away from that area of pressure, those are oftentimes some good areas to invest some extra time and energy in. They're going to get you some good return on that energy investment. And as you can see here, we don't need to be cruising up and down the entire length of the muscle here. We're really trying to engage with that tissue and get that specific spot moving. Around the soft tissue is really, really awesome. It's a great habit to establish, but you are going to need to introduce some external load, some movement to get things really feeling better long term and to keep those results sticking around the way that you want. Got some other options to attack both sides of this stuff at once as well. So you can grab a bigger foam roller. This one's pretty active, pretty good input level, so make sure you're feeling good if you're going to get into this. So you're going to start directly on top of the roller here. We're just going to roll out a little bit, walk hands out, and then we're going to use our free leg and drop that right on top of those calf muscles to create a nice compression and pressure here. And then what you're going to do is just slowly kind of oscillate back and forth a little bit with that top leg. So we're just creating a little sawing motion here. Inch our way down a little bit. Working some active movement. We're really trying to get that tissue moving underneath the pressure in the input. Get those sliding surfaces moving on top of each other the way they should be. The more you sit back onto this tool, the more it's going to increase that pressure into the lower leg for you. All right, guys, that's it for today's video. Hit me up in the comments if you have any questions, need any clarification on anything. Always here to help out. Want you feeling better faster. Like, subscribe, share, do all the social media things. We'll catch you on the next one.